We welcome now to the program Quentin Whitwell, chairman of the board and co-owner, Panola Medical Center. Quentin, how you doing? Good to see you again.
Hey, how are you, Gerard? Good to see you as well. You look very sharp in that tie, and I'm wearing my Lane Kiffin Ole Miss gear right now.
I see that. I love it, man. Got the white pullover with the Ole Miss logo in view. That's awesome. Love it. So, yeah, Lane has kind of popularized the white, I guess, has he not, with the Ole Miss logo? You can always pick him out, see him walking around on the sidelines with that white on, but that's pretty cool. All right, so Panola Medical Center, of course, in Panola County, the Batesville area in Mississippi. I know you've been tracking this issue diligently, that of health care, and in particular, since the legislature's been in session, a very high-profile legislative issue, whether or not the state should adopt Medicaid expansion, something we've talked about quite a bit on the program, including today. I know you're aware that the House committee, led by Chairwoman Missy McGee from the Hattiesburg area, it did, in fact, pass out of committee HB 1725. That is the bill authored by Speaker of the House Jason White, which would implement the expansion coverage group in the state of Mississippi. What do you think about this at this point?
Well, first of all, just a little history. As you know, I've been watching our state and other states for a long time, especially in the South, who have been very hesitant to pass these types of laws. And we have worked very hard on the rural emergency hospital model, mainly because of the fact that Medicaid expansion has not occurred. And that enables us to operate through essentially all federal rules and regulations. So many of my hospitals I've converted to rural emergency hospital, which has a little bit of impact on the Medicaid expansion, but not quite as much. And we did it because of all the delays and the timetable. And so now, looking at the landscape of the future of having Medicaid expansion, I think it could be of great benefit to many hospitals, and even some of the hospitals that we're looking at and targeting for, purchase and acquisition. Just the recent enhancements did help. Everyone got some additional monies in January, and that really helped a lot of struggling hospitals to continue operations when they were really on the fence. So, as to the particulars of the bill, I have not had a chance to dive into all the details yet, but I have spoken to some leaders and officials, and they do believe that this will be a workable program based on at least the concepts that were put forward in that bill.
Okay. Well, I actually attended the committee meeting yesterday and noted that it passed without any objections, as best I could tell, observing it. And the reason I say that is, as you know, those votes are voice votes. And sometimes people just don't say anything, so you don't know where they stand once a bill gets to the floor. And I know you know the process, and sometimes they'll vote one way in committee and another way on the floor. That's happened as well. So.
That's correct.
Yeah, so I'm kind of handicapping it at 50-50 at this point. I know the Speaker has been a strong proponent and champion for this. It's his bill, obviously. He spoke to my Rotary on Monday. He was the scheduled speaker, and he spent a fair amount of time talking about this issue and talking about this bill and explaining all the detailed provisions. But and then we don't have anything out of the Senate just yet. We haven't seen their official bill at this point, but the lieutenant governor has indicated he supports it, but he also made it clear he would only do so with the stipulation of a work requirement, and that does exist in the House bill. That is going to require a waiver from CMS. I don't know, Quentin. I'm kind of the opinion that CMS is not likely to approve that. The Biden administration made it clear when he was just shortly after his inauguration, as a matter of fact, we're not going to do that anymore. We're not approving these waivers for work requirements. Where do you think that's going?
Well, I've been wrong before, and I could be wrong again. I was very glad to see the enhancement was approved. As you know, last time you had me on your show, I was skeptical that they
Yeah,
would allow the enhancement without the expansion, and they did.
yeah, that's true.
I do. Yeah. I mean, I personally think that these administrations, I mean, politics is just, it's a different world now, as we all know, and it seems to be so polarizing. But my hope is that, at the end of the day, the state of Mississippi does have the right to pass what they believe is workable for them. There have been other states that have, redone the program and the expansion in the fashion that they feel more comfortable with. And I
Sure.
think the state of Mississippi should have the ability to do that. I think, things like work requirements, I mean, it's not something that Quentin Whitwell would put in there, but I understand the reasoning behind it, and it's pretty consistent with what we've said all along on welfare laws and other things like that. And so,
Yeah.
I mean, I just have to see the final product, but I hope that whatever Mississippi passes is workable, and I do hope that it is approved if we in fact pass it, because it really would be really bad if after all these years of rejecting it and not accepting the funding, if we finally say we're going to accept it, but then we don't get it. So.
Yeah. Yeah, that's true. And of course, the way the House bill is structured, if the work requirement waiver, if that waiver is not approved by September 30th of this year, the Division of Medicaid is instructed, would be instructed by law to continue to implement the program absent the waiver, absent the work requirement, is the way it's set up. But it does have a 4-year repealer on it. So essentially, I guess you could kind of say it's temporary, it's a dry run. I think it's fairly unlikely that at the end of 4 years, either that repealer isn't pushed out or the legislature doesn't take some other action to extend it, make it permanent, something to that effect. You'd be talking about adding up to 250,000, maybe even more. We don't know the exact number, but most estimates peg it at 200,000 to the program. It's unlikely you just terminate the program and have these people go back to the uninsured roles, which is a big problem in the hospital industry, is it not, Quentin?
It is a big problem. I mean, the millions of dollars of uncompensated care that all of our hospitals are having to write off while we are providing all of those services, along with the fact that both commercial carriers and, of course, Medicare payment structures continue to go down, or prior authorizations and other things are stipulated that allow us to not get paid as often. The margins are just slim, and so when you're doing all the right things, you want to be compensated for as much as you possibly can. And and I'm of course, the good thing about Mississippi, based on the reports I'm seeing and the things the governor's putting out, it looks like Mississippi's doing really well with the low unemployment workforce anyway. So maybe it's not going to affect very many people in Mississippi because we got people working. So that's a good thing.
Yeah. Well, we still do have a very low labor force participation rate. We have low unemployment, but of course that doesn't account for people that aren't actually looking for work, and that's where the labor force participation rate comes in. I think that's part of the impetus for the Speaker and the Lieutenant Governor here with this Medicaid expansion is we include this work requirement in there. Maybe we can get people off the sidelines and go out and seek work because they would be able to enroll in Medicaid and have health insurance. I think that kind of remains to be seen as to how big a motivator that would be.
Well, you're right. That would be very interesting. I've read a Wall Street Journal article about Mississippi having low participation in the workforce, and the governor mentioned that a lot of it has to do with conservative values and people, stay-at-home moms and things of that nature. And I don't know all of the data behind all of that, but certainly I think those are things that we don't seem to think are bad things. So, I mean, I don't want to exclude people that are not working for good reasons. Maybe, they have a spouse that has a good job and they want to, be there for their family. So, we got to think about that too. What
Yeah.
are we trying to really, what is our true objective here? But hopefully we'll pass this Medicaid expansion and we'll let it go to work and see if it helps our rural hospitals.
Quentin, good to see you. Appreciate you joining us today, and we'll be tracking it, and I know we'll be getting together soon to talk some more about that. Thank you.
Come see me in Oxford. Take care.
You got it. Coming right back, folks, in the Element Wealth Studio.